I think a lot of the mindset stuff comes from our own personal expectations and standards for ourselves. And this might be compared to, what we previously thought about our pre-pregnancy body. And if this is our first baby, now we're considering this body doesn't feel like ours. And so number one, it's just give yourself so much grace through this process and transformation. And also, if you having a second or third or fourth or seventh baby, like every single birth experience and postpartum experience is going to be different.
Getting pregnant and giving birth are two of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started. Our reviewer of the week is A. Hurst, and she says, informative and diverse. I absolutely love all of the birth stories, as well as the professionals who come on the podcast and share their expertise, insights, and knowledge. The diverse group of birth stories is encouraging, and I can usually relate to one or more things from each one. Stephanie has brought helpful insight and guidance to my pregnancy, birth, and postpartum journey, as well as our first pregnancy, which ended in miscarriage. Thank you for all that you do, Stephanie and team. I'm so sorry about that miscarriage, and I'm so glad that you are finding the strength and hope and knowledge that you need as you continue on in your birth journey. So thank you for being here. Again, if you have not left a review, please make sure and go do that. It helps the show reach out to mamas all over the world. So today, you are listening to the Pregnancy and Birth Made Easy podcast. I'm Stephanie, I'm your host, and today we're diving into one of those most overlooked parts of the motherhood journey, which is your postpartum recovery, specifically those first 0 to 6 months after birth. So yes, we're going to take it a little bit farther than just that 6 weeks. So if you're wondering where to start and how to know if it's safe to be moving again postpartum, or you're hoping to return to some of those strength workouts, you're going to want to hear what today's expert has to say. I'm joined by Dr. Jessica London. She's a doctor of physical therapy, a pelvic floor therapist, pre- and postnatal coach, podcast host of What About Mom, and the founder and owner of Your Postpartum PT and Wellness, which you can find at Your Postpartum PT on any of the social media channels. And she's walking us through a realistic healing first roadmap for your postpartum recovery. So this is going to be from how to move safely in those early weeks to the signs that you're pushing it too hard too soon. This conversation is full of those golden nuggets for mamas who want to prepare now for a smoother recovery later. As a special bonus, our guest is offering a free resource that you're going to love, especially if you're wondering how to rebuild your strength and to feel confident in your body again postpartum. I'll tell you exactly how to grab that guide in just a few minutes. Welcome back to the Pregnancy and Birth Made Easy podcast. Jessica, thank you for being here with us again.
Yes, thanks for having me back again, Stephanie. It's a pleasure.
Yes, and for those who are listening, we have had Jessica on recently and you guys absolutely loved her, so we have her back again. So I'm going to make sure to include in the show notes a link so that you can listen to both of these amazing episodes. But with that, let's get started with the basics. Can you tell us a little bit about what is happening inside of a woman's body during those first 6 weeks postpartum?
Absolutely. And I always joke with this is like, what's not happening, right? There's so much happening those first 6 weeks with your milk supply coming in and you're trying to manage bleeding and all of those things. But I'll speak mostly from a rehab musculoskeletal lens, just so the listeners can really tune into what's happening to their body from a healing perspective. So of course, with vaginal birth and C-section birth, very different things are happening for these moms. And I think that's one of maybe the missed marks in the postpartum rehab and hospital setting. When moms go home, they're not really taught a whole lot about what's going on, whether they had a vaginal birth or a a C-section. So early on, typically what happens is when there is inflammation in the body because there was quote unquote trauma, right? If there was any tearing, any incision with a C-section, the body just goes into immediate like fight or flight mode, and it goes into healing mode, right? So we're thinking about blood clotting, we're thinking about the immune system's kind of kicking up again for you as well. And so this can attribute to a lot of like heaviness feeling, a lot of potentially pain sensations, because the body is like, alarm signals go off. We are not in a good state. And that's why you might be having a little bit more pain, discomfort, heaviness in those first 6 weeks. What you should also notice is that gradually your body is going to start feeling a little bit more structure, a little bit stronger, because while we go through that tissue healing, timeline and protocol, if you will, where the body naturally is going through its own healing response, we'll tend to see then we're turning into laying down new tissue and increasing the structure of the tissue. And so the body naturally is incredibly smart. It knows how to heal itself, but what we can do is give it a little bit more love, depending on if somebody had a vaginal birth or a C-section birth, especially in those first 6 weeks.
I love that. And I do want to get into that just a touch in a couple of questions here. But I know that women hear a lot of the time that whole like 6-week checkup, like you're cleared for all this stuff. Does that really mean that you're cleared for anything? Or especially when we're talking about pelvic stuff, can you tell us a little bit about that?
Yeah, absolutely not. I mean, this is going to be dependent, right? Disclaimer, this is so dependent per each person's body, right? Every woman, every mother is going to go through their own healing experience. And you can't just compare, oh, well, I had a vaginal birth second degree tear and I had a vaginal birth second degree tear. You're still going to live two totally different experiences. This can also, play a factor of if you trained before in pregnancy. Did you keep your strength training up? Did you, continue to build that muscle strength that you needed into postpartum, or didn't you? What type of support do you have? What is your stress levels like? Obviously, so many things go into this. But really, when we think about 1 6-week checkup, that's only 10 minutes to quote unquote clear you for anything, ask you about birth control and clear you for intimacy, it's really doing the mothers a disservice, in my opinion. So what we like and what we believe in is early acute rehab, right? So this early acute phase of week by week, it is totally safe for our bodies to be able to start getting some gentle mobility, some gentle reconnection exercises in, and they just progress week by week as your body is able to tolerate more. Again, it's going to be different for every person's body, depending on the birth method, birth injuries, and support level as well. But to just assume that we're supposed to do nothing with no guidelines, no structure, no strategies for 6 weeks, we go to this 10 or 15-minute checkup and then we're cleared. What does that even mean, right? What does cleared even mean? It really doesn't mean you should just go right back into the weight training gym without any lead up or progression back to being able to return to your normal exercise.
Yeah. So what does exercise kind of look like shortly at like when they are quote unquote cleared, especially for moms who want to jump back into it? And I actually want to ask about intimacy as well, because I know that's a big one. Moms and dads. Dads are like, when can we do this again?
I know. So, he's like ready to go.
Yeah, totally. So tell me more about that.
Yeah. So what does exercise look like, right? I think that in a perfect world, and of course, if you're listening to this and you're beyond postpartum, just know that you did nothing wrong. You're totally okay. And you can always try again the next birth experience or just give yourself grace and love. But I think in a perfect world, the first 2 weeks, exercise looks like breathing and really focusing on mobility in our rib cage and our lower abdomen, allowing our pelvic floor to get natural relaxation and lengthening in. So it kind of serves as this internal abdominal massage and internal pelvic floor massage where we're teaching the body, hey, we don't need to be in fight or flight anymore. We can shift into parasympathetic, which is more of our rest and digest. This allows you to get out of pain faster. It allows you to heal a bit quicker as well. When we can just reconnect to our bodies, give it some gentle mobility, some gentle breath work, allowing things to just release and lengthen. And then in a perfect world, right, if we're kind of preventatively thinking about this, or if you're, week postpartum now, around that 2 to 6 week mark, what we've found that works best with our clients is starting to add more activity in. And this doesn't mean getting up and going for long walks or anything crazy like that, or starting to do bodyweight squats even for some people. 2 to 6 weeks can actually really look more like what can we do in your bed or around your bed in a backline position, a sideline position, maybe your hands and knees, that starts initially gravity eliminated, meaning we're not putting you in an upright position right away if you just had a vaginal birth, because we want to protect the perineum. We want to protect the pelvic floor that was just stretched 2.5 times its normal resting length, right? So we want to teach you how to reconnect in more of a gravity eliminated position, which typically looks like backline, sideline, hands and knees. Now, moms can progress through this timeline as their body is starting to feel ready. And again, if they were former athlete, then they might start this a little bit quicker, but then we can start doing more activity in an upright position. This is just called progressive overload. It's very basic rehab and strength training guidelines for us to be able to start slow, start with mobility, start stretching, and then we can start with activity and exercise leading up to 6 weeks. Around that 6-week mark, maybe you didn't do any of that. And now you go to the doctor and you're like, I'm cleared. Well, I would still have you start actually back where we would normally have people start just day one after they have their baby. I would still have you, even at 6 weeks, still start with a week or two of gentle mobility, gentle breath work, gentle reconnection, and then start in gravity eliminated first, and then progress your body up to more uprights, adding more resistance, adding more weights in due time.
Yeah. And as you're saying that, I'm like, it all makes sense. But as we are postpartum, I think sometimes we're just not thinking of that. And I know myself, like, I like to get up and go. And so I remember after having my first baby, and my first one was a cesarean too. So as soon as I was quote unquote cleared at 6 weeks, I like bought this birth boot camp program and I was like, let's do this, you know? And it was so funny because the first push up I tried to do, I like hit the floor and I was like, what happened? Like, how come I have no strength? But I'm thinking of like the perineum and stuff, because there were lunges and squats and like all this, like get your body back kind of stuff, which I was totally into. But at the time, you know, not thinking about the safety of my perineal area or just, you know, my breath work or anything. And really just everything feels so, even after 6 weeks, like there's still a lot of like loose to everything, and your organs are still kind of, everything's not all tightened back to where it should be. And it really does take months and months for that healing to occur. So I love that you're sharing that. Like, even if you didn't do any of this for the beginning, start slow. I think that makes a lot of sense. One thing I did want to ask you about though, because something I really encourage moms to do, I found that this really helps with postpartum mood disorders, depression, anxiety, that kind of stuff, is to get outside. And I say walk to 15 to 20 minutes, but are you saying that might be a little too much and that maybe the motion happens in the bedroom, but you still get your body and eyes and mind outside as well?
That's a great question. I'm such a fan of fresh air and sunshine and getting you outside. It really makes such a huge difference. Not only for you, for your baby, the whole circadian rhythm, all of that stuff. Absolutely. For us, like what we share is that first week for sure, that first 7 to 10 days, we try to keep most of the upright movement around, you know, the house, right? Maybe you can go in your backyard and get some fresh air and ground outside and put your feet in the grass, or go out in the front yard and watch your little one ride the bike. So you're still getting all of those benefits of the fresh air and the sunshine. But we really, you know, in our belief system, we try to avoid long distance walking the first 7 to 10 days. And then around like a week and a half, 2 weeks, we start to see our moms wanting to move a little bit more. Like intuitively, the body might not want to go for a 15-minute walk at 3 days postpartum when your milk supply is coming in, but it might feel like, oh, you know what, a week and a half, 2 weeks, like my body's actually craving some movement, which actually really aligns with tissue healing, right? So initially, body's like going into, let's protect the body, let's lay down new tissue, let's send the immune signals, let's do all of that. But then after about 7 to 10 days, then we get out of that inflammatory phase and we're getting more into repair mode. And so what actually does help repair mode is actually putting strain and quote unquote stress on the body, right? And so when we put strain and stress on the body, it actually helps build resilience in the body and it builds tissue tolerance. So typically for our vaginal birth mamas, 7 to 10 days, we're like, hey, let's try to avoid long walks. Let's try to avoid putting too much pressure on the perineum early on if we can, and do most of that gentle reconnection and that breath work. And it still means you're moving. It doesn't mean you're not doing anything for 7 to 10 days.
Yeah.
But let's try to keep it like in the backyard, the front yard, in the bed, around the bed. For C-section mamas, to be honest with you, very different, right? Because with C-section, there's actually quite a bit of research that shows early ambulation helps reduce post-operative complications and what we call bounce backs to the hospitals for infection or, injuries of that nature. So actually for C-sections, I'm like, get up and go for a 10-minute walk or 5-10-minute walks in the hospital before you even leave. Maybe with a walker, with someone holding your, arm and for support and everything like that. Make sure you can get to and from the bathroom before you go down the hallway. But for me as well, I had a C-section for my first birth and a VBAC for my second. I was walking the hall in the hospital because that's also intuitively what felt good to me. And it really does and is supported by research is early ambulation helps reduce blood clots. It really helps just get the immune system and the blood flow working together again and really reduces post-operative complications.
Yeah, I love that. I love that you're kind of sharing like intuitively our bodies know and science backs what our intuition is telling us. That's beautiful. That was actually going to be kind of my next question is how those two things are different. Do you have anything else that you think precaution-wise or knowledge-wise moms should know vaginal versus C-section?
Yeah, I just think it's important to remember that the more injury, the more trauma you have, like give your body more grace to recover, right? Sally down the street who had no tearing or first degree tearing versus Susie who had a fourth degree tear and episiotomy, those are going to be very different recoveries. And so one, give yourself love and grace, but also two, just from a true evidence-based, science-based tissue healing timeline, those are going to look like different birth recoveries where one person might be doing breath work and upright movement earlier. The other person might not. They might be on their back a little bit more or their side a little bit more. It might just take them a little bit longer to reduce the pain and to get that structure that they need, which we were talking about a bit earlier.
Yeah, that was kind of it was going to be my next question had to do with like, but what if a mom has torn or she has prolapse or, prior exercise or exercise during pregnancy? So it kind of sounds like we trust our bodies and move slowly and there's a process. Are there certain things that moms should pay attention? Like those are kind of like red flags that stop, you need to take it a little bit slower, relax, or reach out to somebody. Are there things along the way that they can say, I'm doing too much or too little?
Yeah, this is so good too, because I think mom's ears like perk up of like, wait, what should I be on the lookout for? Right. And so it is just that, right? So typically what we say is an increase in severe bleeding, right? If you are starting to notice like, oh, I'm starting to bleed less week by week and day by day, and then all of a sudden you're noticing a significant increase in bleeding, this is just a sign of asking yourself the question, was your activity way accelerated that day? Was that when your husband went back to work maybe, and now you were back at home with the newborn and the toddler and your activity was way up? And so just being mindful of the exertion that you're putting into what those symptoms are describing, because sometimes they are directly correlated and sometimes they're not, right? Other signs and symptoms to be on the lookout for, especially these first 6 weeks, is like any like burning sensation or severe like itching. This can be signs of risk of infection. This is definitely like obviously call your OB, your midwife, make sure you're checking into that as well. In terms of pelvic floor related, some leakage is normal for up to 6 weeks, especially if you just went through birth and there was a lot that went on your body. Things are getting reorganized. Your uterus is still shrinking down. Like give your body grace those first 6 weeks. But really, if symptoms like leakage or severe pain, back pain, pubic pain, groin pain, hip pain, with that pelvic heaviness or feeling like something's going to fall out, or maybe you go to the toilet and you just feel this like whoosh kind of come into that perineum area as you're toileting. Maybe you're having pretty severe constipation, or maybe you're not able to get pee out and you're dealing with some bladder retention, or even bladder urgency or frequency, feeling like if you have to go to the bathroom, I have to like go right this second or I'm going to pee my pants. Those symptoms, like the first 4 to 6 weeks, like that can be kind of common, but we do want to see them decrease over time, like week by week as your body is healing. We would expect any of those symptoms that I just said to be improving, not getting worse. Now, if you're like beyond 8 weeks and these are still there, 8 weeks, 10 weeks, 12 weeks, 6 months, 6 years, like these are all symptoms that you should really reach out to a pelvic floor specialist. Whether you work with us virtually or not, or you go to someone locally, like getting in store with a pelvic floor rehab professional, OT, PT, a pelvic floor rehab provider that is going to take that hybrid approach with you is going to be really important to the healing process to try to reduce as many of these symptoms that you're feeling as possible.
Yeah. And I love that you guys have the online option because I feel like for some moms, it is so hard to get the help that we need just simply because of that. Do we have transportation or do I have little kids I have to bring with me, or just the time in general can be such a stress. And so having something online is so nice. And I love that you guys have that. I know we're talking about that kind of like, we've talked about that 6-week period, but today we were really going to talk about 0 to 6 months. What does this look like, especially for moms who are like, I really like to be active, say that they want to get back into like HIIT or CrossFit or whatever, and maybe they did or didn't do it consistently during their pregnancy. What does a roadmap for those moms look like?
Yeah, absolutely. We did a really good job of covering kind of 0 to 6 weeks and what happens after that, right? So you're starting with breath work for a couple of weeks, and then you're starting that gentle reconnection for the next like 4 to 6 weeks and quote unquote ideal world, right? And then you're starting to think about, okay, what does a true pelvic floor and core rehab program look like? Kind of what you were mentioning earlier is like this, I'm going to start strength training again, lunges and squats, and it just throws you right into that. Those are not bad exercises. Those are really great exercises, but maybe at the wrong time, right? So really what we want to focus on first is building that internal core canister again, the connection between the pelvic floor and the deep core system, and making sure that is solid as a good foundation as we are starting to progress people up more towards lunges and squats and then eventually into burpees. So typically, it's about, 6-ish weeks of that early acute, getting your body up and running. And then we can start really focusing on harder pelvic floor and core exercises for the next 6 weeks. So the first 0 to 12 weeks, really think about it as like pelvic floor and core rehab, right? Like we're really focused on getting a good solid connection between our pelvic floor and our core, healing from the birth that you had exactly, whether it's C-section or vaginal birth. With C-section moms, we're working into the scar tissue, into the abdomen. So focus the first 12 weeks to simplify the process on birth rehab, right? And then the next 12 weeks, 12 to 24 weeks, this is a really great time to now start building strength. So depending on where you're at, you have a good foundation, you really focus on your pelvic floor and core rehab first, and then that will slowly transition into, more of those exercises like lunges and squats and side lunges and, Bulgarian split squats, and you just progress it harder and harder from there. You go from double leg to single leg, and then once you master that, then you can add increased more intensity, which is more like trying little hops. Can I hop on one single leg? Can I hop on 2 legs before you just go out and run, right? So we're really slowly and progressively building up and testing your strength, your endurance, your coordination, that 12 to 24 week mark, that by really around that 4 to 6 month mark, what we find is if moms really are working with us from the beginning all the way up into that point, we can safely get moms back under a barbell, start jogging again, start running again around 4 to 6 months postpartum. And for some people sooner. Some people it's 3 months if they had a relatively easy birth experience and they were already strong before, then we can really kind of move through that pelvic floor and core rehab phase faster. But traditionally what we're seeing is that 3 to 6 month timeline is where we're really building strength and where we're starting to get moms back into that higher intensity or weight training aspects.
Are there different things that you're looking for 6 weeks to 6 months when it comes to I've pushed it too hard? Because by that point, you're not like, oh, I'm bleeding too heavy, or, maybe you're feeling different things. Are the sensations that they're looking for different?
Yeah, an increase in leakage, an increase in heaviness, an increase in pain. So we really let your symptoms be the guide. And so, when you're working with a pelvic floor rehab specialist, they really should be very closely monitoring and progressing you slowly as you are feeling more stronger and more capable. You actually want the person that you're working with to challenge your body, because the challenging of the body in a safe environment, right, in a container that is educated and knows what they're doing, we want to challenge the body because we want to see what the body is capable of, and we want to see how your body is progressing. And that also gives us indication of, okay, let's start a walk to run program instead of just let's run a mile. Well, if we walk run and you're already experiencing pain and increased leakage with a walk run, then we're definitely not ready for a 5K. right? So it just gives us a lot of insight into how your body is healing and how it's recovering. And those are the signs and symptoms that we would know, okay, your body might not be ready yet. And it doesn't mean that we need to be 100% symptom free before you are running, right? It doesn't mean that, because we can build strength through running, right? But we can always use a graded exposure approach, which is really helpful for getting back there safely eventually as we are building up your strength, your endurance, and your coordination.
I love that. All right. You've created something really awesome for moms. So those of you that are listening, I kind of teased this at the beginning of the episode, but if you're wondering how to safely start moving again and kind of rebuild your strength without overdoing it, you've created something called the Core Recovery Guide just for our listeners. Is that right?
Yeah, absolutely. It's super easy to follow and to dive into.
Will you explain just a little bit about what's in there, and then I'll tell everybody how they can get it?
Yeah, so I'm a huge visual person. So there's a ton of visual anatomy diagrams so that you really understand, like, what is the pelvic floor and where's my core? Like, what does that even mean? And what does pressure management mean? And so it really dives more specifically into, like, what is the core? How does it all connect and how does it all work together? And then I even provide some sample breathwork exercises and some other exercises in there as well, so that you can not only get the education that you need, but also some starter breathwork and more simple exercises just to get you connected to that core system.
Yeah, I love that. And it sounds so good. And it's for you guys. I've totally taken a look at it, and it's amazing. So you guys can pick that up at myessentialbirth.com/core. And I'm going to link that in the show notes. Plus, if you guys are on the email list, then you'll grab it there too. But I'm really excited for them to have that. So thank you. Let's go over maybe some mindset and support kind of things. So I know that there can be a lot of pressure for that, like, bounce back, or even just, shouldn't you already be up and moving? Shouldn't you be back to work? Shouldn't you be making dinner? And what kind of things can we do as far as mindset goes? Is that something that you guys deal with, being like pelvic floor therapy too? Okay, talk to me about that.
Yeah, absolutely. About 30% of the moms that we start with actually work with us in pregnancy. They start with us in pregnancy and then they just move into postpartum. Oh, so smart. If you are pregnant listening to this, second trimester, like, that's your spot. Just really get started on this stuff. But really, we start that mindset work in pregnancy, right? We're preparing you and your body to know, like, we can't control everything and we have to really commit to the surrender process. So especially for our first time mamas, this is challenging, because we don't know what we don't know. And motherhood takes us through a whole portal that really has us humbled, and it really transforms us as individuals. And the motherhood journey in itself is a journey of surrender. At least it was for me. And I think a lot of the mindset stuff comes from our own personal expectations and standards for ourselves. And this might be compared to, what we previously thought about our pre-pregnancy body. And if this is our first baby, now we're considering this body doesn't feel like ours. And so, number one, it's just give yourself so much grace through this process of transformation. And also, if you having a second or third or fourth or seventh baby, like, every single birth experience and postpartum experience is going to be different. And I think we need to just honor that first and foremost, that it's going to be different for your body, whether you had two different birth experiences and two different postpartum experiences. So of course, it's going to be different than some other human's body and vessel that's not even our own. And so we need to really stop the comparison. I think that's the first thing that we can really allow our mindset to be at ease, to give ourselves love, to give ourselves grace and compassion, to know that we are on our own individual journey. And our own individual journey has so many variables of why it is unfolding the way it is, right? And so when we look towards another's body, or society tells us to just bounce back, it's an old narrative that we really collectively as moms just need to fight back and drop. But also, we are our own worst critic. And I'm saying that, speaking that from experience and from the hundreds of moms that we worked with, they are most hardest on themselves. And this is just based off of old beliefs, old patterns. And so really during this motherhood timeline and, journey and portal that we travel through, it really is about changing the narrative of our own beliefs, our own intuitive knowing, and just allowing your body to go through the process and journey that it was meant to go through.
I like that. And it just makes me think of, social media too. It's such a big thing. And it's so easy for us to be excited to, like, scroll through and see all the things and to see other people that are going through the journey, like a similar journey that you're going through. but what we see on social media is so different from what really exists. And so just following the accounts that are going to either show it all or kind of staying away from social media when you need to, I think can be really helpful too. That is certainly something that when I was having my babies, I didn't have to deal with that as much. But I find myself comparing, as even in my business, and so she's farther along or she started after me, and it's like, so yeah, I can only imagine what that does to a mom postpartum watching.
Yeah, there's already enough emotions and hormones at play and all of the struggles that come with it. So if you need to unfollow people.
I love it. Yeah. What's kind of, if I could ask you this, what's like one thing that you wish that every pregnant mom knew about pelvic floor health or this kind of care or recovery before giving birth?
Yeah, it's never too early to get started. We even have moms that are in pain now, starting towards the end of first trimester, right? But if you're having symptoms, I think one of the big myths in pregnancy is like, well, I'll just wait until postpartum. Like, well, why? Why are you going to spend the next 6 to 9 months totally suffering, being in pain, having pain with intimacy, peeing your pants, changing your panty liners, dealing with pelvic heaviness if you don't have to, right? So you can absolutely make changes and make progress to your pelvic floor, to your core and pelvic floor health in pregnancy. Not only number one, to get rid of the symptoms so that you're not suffering through pregnancy and you're not waddling and in pain through pregnancy, but two, everything that you do in pregnancy will absolutely not only impact your labor experience, but also your postpartum recovery experience as well. So we are seeing a connection and support to those that continue to strength train in pregnancy. They tend to have less aches and pains. They tend to have better and smooth labor experiences. And they also keep that muscle mass into postpartum. Now, if we think about what can happen if we take pregnancy, not off, if you will, but if we don't continue to strength train and build that muscle mass throughout pregnancy, we can imagine 6 to 9 months, you're not strength training. And then you go through the birth experience and there's a significant amount of muscle wasting and muscle loss that happens throughout pregnancy just because of the body changes. Muscles are shortened and some are lengthened. And so that equals a decrease in strength. And so then if we're trying to pick it up at the 6-week checkup, we've now not been strength training or not been active for almost a year, right? Or even at 3 months postpartum when you're starting to get more activity in. So the biggest thing that I can say is during pregnancy, if you have the ability to and you don't have any medical complications to not, it really is important to just stay active and to continue to build strength throughout pregnancy. So that it can benefit you for the rest of the journey.
I'm so glad you're saying that because I feel like we even still have a stigma for moms. Like when you get pregnant, you need to relax, take it easy, all of this. And it's like, okay, I don't know. I think women are pretty strong. And I think like from the beginning of time, like they still had to go wash the clothes down at the river and carry all their big stuff or like bring the water back or like, and other countries, that's still what they're doing. So I don't think it's this time to be like, oh, let her rest, stay in bed. What you're saying is totally true. I mean, that is what held true for me when I'm talking about like, I went to do a push-up and I hit the floor, like all muscle gone. That's exactly what happened to me. I worked out before. I didn't do anything during that pregnancy, maybe walking. But that's what I was being told, So I love that we're telling women now, no, you're stronger than you think you are. And you should be, working with some of that muscle, which I always like, I've got my weighted vest that I'm wearing everywhere now, right? Because I don't have a baby in my belly, but I'm telling moms all the time, like, you have the perfect weighted vest, you have your own little weight, like go take it for a walk, go do some lunges, go, whatever. So yeah, I think that strength training is so important. And I actually, if we can talk about just for a moment before we jump off here, the pregnancy part of things, because I know we're talking this 0-6 months recovery, but you're telling moms, see me when you're pregnant. This will be a benefit to you. What are some of those things that you work on prior to giving birth? Because I know a lot of women, just like you said, postpartum, if we're having issues now, it's time to see the physical therapist. But what is that really?
Yes, please start in pregnancy. Please start in pregnancy. About 30% of our clients start in pregnancy. I wish it was 70%, but I agree. It was just probably because of the lack of education and awareness around it. And, considering like, oh, birth is this big medical emergency and pregnant moms are weak and we just need to protect them. And so, yeah, like changing that narrative that we need to start in pregnancy and that is the perfect time to start. So if you were to start in pregnancy, first and foremost, it's, do you have any current lingering symptoms, right? Because that's like, let's get you back to baseline, right? Let's just get you back to baseline. If you're leaking or having pain with intimacy or having pelvic heaviness or pelvic girdle pain, back pain, hip pain, whatever it might be during pregnancy, if you come to work with us or another pelvic floor specialist, the first thing that they should be focusing on and that we would focus on is, let's reduce the symptoms as much as possible. Let's bring your pain from an 8 out of 10 to a 1 out of 10. What can we do to immediately just try to get you back to baseline? After we restore that and we're not seeing as much symptoms, and kind of simultaneously, right, we're also starting a prenatal strength training program. So the best time is really when you round that corner into second trimester. This is a great time to start prenatal strengthening. I know the first trimester can be like really tough for a lot of moms, especially if you're super nauseous and you're not feeling well. This might be a time where we're like, yes, please rest, take the naps, make sure that you're taking care of your body that first trimester. But second trimester, we start to pick up some energy, and for the right reasons. Our body was designed to start picking up some energy again for us in that second trimester. So if you were having symptoms, the best time is to start when you're having the symptoms. But if you don't have symptoms, right, you can still absolutely start in pregnancy around that second trimester to start a more formal prenatal strength training program. This is to increase the, core wall integrity. A lot of times people say, oh, I can't do core strengthening anymore because I'm pregnant. And that's like, no. Actually, we need to continue to maintain your core strengthening to reduce the severity of diastasis, because diastasis is going to happen whether we want to believe it or not. Nearly 100% of moms have some form of diastasis at the end of pregnancy around that due date. But we want to try to reduce the thinning, the widening, the weakening as much as we can by continuing to safely and correctly engage the core abdominal muscles and just be more active in that aspect. The other things that we specialize in, especially as you're rounding into the third trimester and around 32, 33 weeks pregnant, is we start to really shift more into what we call birth prep or push prep. So a lot of this is very simultaneously done with doulas, which is so amazing, Cheryl, with educators. We don't replace that, but we can come alongside and kind of stay in our lane and work more of the musculoskeletal side of things. So we're teaching the pelvic floor and the core system. Okay, now how do we relax and lengthen? How do we get so somatically and spatially connected to our pelvic floor that when it comes to pushing time, I know how to open, to release, to relax my pelvic floor? Because, the contrary is, we don't need a strong pelvic floor to push a baby out, right? That's what the uterus does. And so we actually need the pelvic floor to open, to release, to lengthen, which also means we need the pelvic outlet, that bottom part of the pelvis, to have the mobility to be able to create more space for baby to exit. We need to also be trying to do things to get baby in an optimal position, which will help support a smoother labor and birth experience. And so a lot of times around that 32, 33 week mark, we're shifting more into birth prep, which can include connecting to the pelvic floor for release and lengthening. It can include pushing strategies, different techniques, different pushing positions that you can trial out and know how to get connected to the pelvic floor in those types of positions, and really just focus more on that end, trying to reduce the risk of tearing as much as possible through perinatal birth prep as well.
Yeah, that sounds amazing. Before we jump off here, please tell everybody where they can find you and if there's anything else that you want to add about what you offer and what you do so that people can get connected.
Yeah, thanks so much for that. We work with clients and moms through preconception, pregnancy, and postpartum and beyond. So really, we're sort of like mom's one-stop shop for anything pelvic floor and core rehab, but we span the lengths all the way into strength training, nutrition to really help moms prep in birth, recover in postpartum, and then really regain their strength and confidence in their body postpartum and beyond. We do this 100% virtually. We're all pelvic floor therapists or occupational therapists, strength training coaches, and nutritionists that really focus on meeting moms where they're at, 100% at home, because as you mentioned earlier, the barriers are the biggest part that are, standing in the way of moms getting the support and care they need. So no childcare, no driving to and from appointments. You can do it 100% customized online with us. And then if you do want to find us and follow along, we're on Instagram at Your Postpartum PT. And if you DM me the word restore, then we can chat one-on-one and I'll know that you came from here.
Oh, that's awesome. Well, thank you so much for being here. Thank you for your knowledge. And I hope people get connected with you.
Thanks so much, Stephanie.
I hope this episode gives you peace of mind and a game plan for those early postpartum months. You deserve a recovery that is gentle, informed, and in tune with your body. And with the right support, it's 100% possible. A huge thank you for Jessica for sharing her insights with us today. Before we wrap up, I want to make sure that you grab Jessica's Core Recovery Guide. It's totally free and it's a step-by-step starting point to help you gently rebuild your core after you have your baby. You can download it at myessentialbirth.com/core. I'll also have it in the show notes. And if you're on the email this week, you can grab it there as well. And if you love this episode, don't forget to subscribe, review, and send it to a mom that you love that's preparing for birth. I'll see you back here next week.
If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step so you're totally prepared for a birth you'll love. See you next week.